Bismillahirrahmanirrahim. It is said that surgeons change the dressings, God heal wounds. Students, in my previous lecture, we have covered the major portion of this chapter, healing and repair. So far, we have learned about the basic concepts of repair, regeneration, growth factors, cell cycle, and finally, angiogenesis. Today's lecture is going to cover the last and most important part of this chapter. First of all, let's take a look at contents of the today's lecture. This lecture will give you a concept that how a wound actually heals, what are its different types, what are the different phases of cutaneous wound healing, and what are the factors that might interfere with the healing process, and finally, what are the complications that may arise during and after this healing process. First of all, we should understand what is meant by wound healing. Wound healing is the process by which the body attempts to or tries to repair the damaged tissue after any kind of the traumatic injuries. And these traumatic injuries could be anything like minor ones like paper cuts, knife cuts, or the major one like proper stab wounds, or the major wounds resulting from the road traffic accidents. Healing of skin wounds represents the classical example of both the regeneration as well as repair. In regeneration, as you all know, there will be complete reconstitution of the tissue. However, in case of the repair, this is not possible, and the damaged tissue has to be replaced by the fibrous tissue. So here we are taking the example of healing of skin wounds, because it includes both the process of regeneration as well as repair. Healing of skin wounds can be achieved in one of the two ways, either by the primary intention or by secondary intention. Let's take an example. You're trying to pick up the broken pieces of glass and you accidentally cut your finger, or while shaving, you accidentally cut your facial skin. These are the minor cuts. So, and it is very likely for these minor wounds to be healed by the first intention. So, in wounds where first intention has to occur, it will have the following characteristics. These wounds would be cleaned, they will be non-infected, they will also include those wounds which are surgically incised. And in such wounds, the edges will be approximated by use of the surgical suture. So the incision, it will cause only the focal disruption of the epithelial basement membrane continuity. So as a result, what happens? There will only be few cells and connective epithelial and connective tissue cells which has died. As a result, what happens? The epithelial regeneration will take over the fibrosis and small scar tissue will be formed. In those wounds which have to be healed by the secondary intention, let me give you an example. There is a biker who is overspeeding, and what happens? Finally, he ends up with he lost control of the bike and end up in a hospital with serious injuries. In such cases, healing by secondary intention is likely to occur. Due to a loss of significant amount of the body tissue, the body cannot regenerate the whole lost tissue, and it will try to compensate for the lost tissue by forming larger scar tissue. These wounds will have the following characteristic. They will be opened, there will be large tissue defects, and mostly these wounds would be infected. As a result of the large tissue defect, so there will be extensive loss of the cells and tissues. And in these wounds, the edges cannot be approximated by the surgical sutures, but mostly they are left open in order to achieve the drainage. Basic events in both the primary and secondary union are similar. but differ in one point that in secondary union, these wounds will have a larger tissue defect, and this larger tissue defect has to be bridged by formation of a larger or a bigger fibrous connective tissue, and as a result, a large, ugly scar will be formed. Healing will take place from the base, like this is a defective part. Healing will have to be take place in the upward and from margin inwards. In this direction, healing has to be take place. This slide shows, here you can see a large wound present on the forehead, and here you can see a large scar tissue present in a burn patient. This is Dane Gaffney, an English actor who met a serious accident in 2013. He survived that accident, but a large scar is still visible on his forehead. Actually, he wasn't wearing a seat belt while driving, so please do buckle your seat belts whenever you sit in the car. Coming back toward our lecture, this slide shows the differences between the primary and secondary type of wound healing. For the primary type of healing to occur, the wounds are usually clean. They are not infected. Their margins are surgically cleaned. Sutures are used to bring the edges together, and there will be small granulation tissue. As a result, a small linear scar might be formed, and these wounds, they are in these wounds usually no complication is seen. However, in case of those wounds which are not clean, which are infected, whose margins are irregular, sutures cannot be used to bring their edges together. As a result of the larger tissue defect, larger granulation tissue will be formed, and so a larger ugly scar will be formed. And in these wounds, a complication is a frequent finding. Students, this table is very important from your examination point of view, as the examiners love to ask this question, both in the theory as well as in the exam. So you need to memorize this. Now coming towards the steps of the wound healing. This is the diagram of a normal skin showing the epidermis. The purplish part shows the epidermis, and the lower, this yellow part, this is the dermis, lower part of the dermis. In the next wound, in the next picture, you see there is a large breach in both the epidermis and dermis. Now, what are the phases of wound healing? The phases of wound healing include mainly includes hemostasis, inflammation, proliferation, and maturation. The first step in wound healing is the hemostasis. Let's start with an example. A sharp object cuts your skin, and the dermis and epidermis, blood vessels lying within the dermis will be severed, and the blood will start to ooze out. Soon the blood will be stopped. Why? Because the blood, there will be formation of a blood clot due to hemostasis. Let's look at this diagram in order to understand this blood clot formation. So what happens when the skin is damaged? There is a breach in the vessel wall. Automatically, the vessel will cause vasoconstriction. As a result of this vasoconstriction, lumen of the blood vessels gets narrowed. In the next step, what happens? The platelets, which are already flowing in the blood, they will recruit towards this breached part, and they will start accumulating here. Once they are properly accumulated here, the fibrin which comes from the blood, and they form a fibrin meshwork in order to stabilize this platelet plug, and hence the blood bleeding will be stopped. Next comes the inflammatory phase. In inflammatory phase, what happens when after the hemostasis, there will be release of vasoactive and chemotactic factors, which will cause the blood flow to increase in that site, and it will also increase the capillary permeability. So what happens after this? When the capillary and the blood vessel permeability increases, the gap between the endothelial cell increases, and the inflammatory cells, they will start to ooze out, or they will start to move out of the blood vessel, and they will reach here at the injured site. So what the first cells to reach here are the neutrophils. What these cells will do, they will start to eat up this any bacteria if present, and the cellular debris. The next step is the proliferative phase. Proliferative phase, you can see here, is the granulation tissue formation in the defective part. Granulation tissue, here you can see sprouting blood vessels, newly formed blood vessels. These are the pointed fibroblast. These ones, flower-shaped cell, these are the macrophages. And you can here see the upper epithelial cell, they have started to divide mitotically, and ultimately they will move in this direction towards each other to meet in the midline. So this is the proliferative phase. Here you can see the skin cell at the edges of the wound, they begin multiplying, and they will migrate toward the center of the wound. They will multiply by the process of mitosis. Once the advancing epidermal cell from both the edges, they meet in the midline, the migration here, it will be stopped. Now the migration will start in the upward direction. And these cells will continue to divide until full thickness of the normal skin is achieved. Then comes the remodeling phase. Here you can see the upper epithelial layer has completely regenerated. And if we look here underneath this epithelial layer, there are a lot of fibroblasts, spindle-shaped fibroblasts. These are the macrophages, and these thread-like structures, these are the collagen fibers which have been secreted by this fibroblast. And here ultimately a scar tissue will be formed, and you can see here, rarely you can find a blood vessel. No blood vessel is seen. So this is the remodeling phase. So now we'll discuss healing by primary and secondary intention one by one. So what happens within first 24 hours after any injury? After the platelet plug formation, inflammatory event starts, and then what happens? The epithelial cells, they will start to meet in the mid, they will start dividing, as I have already told you in the previous slides. Neutrophils will start to arrive at this injured site, and the blood vessels, they have started to proliferate here. Here you can see in a larger wound, the same process is continued. These are the blue ones, these are the neutrophils which have arrived at the edges of this wound, and they have started to eat up any bacterial or cellular debris. What happens in next 3 to 7 days? On the third day, what happens? The neutrophils, they are largely replaced by the macrophages. Now the macrophages come over and takes their place. And if you can see here, these are the spindle-shaped fibroblast cells, and blood vessels have started to form. Newly synthesized blood vessels are forming here. A lot of macrophages are present, fibroblasts are present, and at the same time mitosis is also going on in the upper epidermal layer, and the basal layer has started to regenerate. So if you see here in the larger gap, you see the similar picture. There is a lot of blood vessel proliferation. There are a lot of macrophages, and after that fibroblast will come and they will deposit the collagen fibers. This whole is the granulation tissue. Granulation tissue is actually the repair tissue that is formed during the healing process. It is totally different from the granulomatous tissue. In practical, Dr. Takpa has already discussed in detail. So if you don't remember, please go through her practical. Granulation tissue is actually formed by three main components: the newly synthesized or newly formed blood vessels, the inflammatory cells, macrophages, and the fibroblasts. This whole component, this is the granulation tissue. After granulation tissue accumulation, collagen fibers are started to be secreted by these fibroblasts, and they will start to appear at margins of the wound. Initially, these collagen fibers, they will be vertically oriented, and they will not be able to bridge this gap. At the same time, epithelial proliferation continues, and they will start to repair this whole epithelial gap. So now what happens at the 5th day? The concentration of the newly formed blood vessel, they reaches to their peak as the granulation tissue fills the surrounded area. At the same time, collagen fibers will also increase in number, and they will start to bridge this gap. They will be started to lay down in the horizontal orientation. So what happens at the end of 2nd week? This whole activity continues until 2nd week, after which finally the activity started to decrease. Fibroblast, they continue to produce the collagen fibers. Look, here you can see the thread-like structure. These are the collagen fibers which have now started to repair or bridge this gap. And here you can see similarly many fibroblasts lying a lot of collagen fibers, and they will now bridge this gap. At the end of the 2nd week, what happens? Myofibroblast will start to appear at edges of these wounds, especially in case of the larger wounds. Myofibroblasts are actually the specialized fibroblast which has acquired the contractile protein in order to reduce the size of the wound. So they will appear at the edges of the wound, and they will contract in order to reduce the surface area of this wound. One thing to remember is that wound strength is only 10% of the normal skin at the start of 1st week, and it gradually increases, and it can reach up to 70 to 80%, maximum of 70 to 80% within 2 years, but it never exceeds 80%. So this is, shows just a brief overview of the phases: hemostasis, inflammation, proliferation, remodeling, and what occurs within these phases. So this is a skin in a diabetic patient, ulcerated skin in a diabetic patient. Here you can see the photomacrograph. This is the ulcerated area, and this is the normal skin. Here you can see the epithelial cell, they have started to regenerate. Underlying there lies a large granulation tissue. Here you can see the whole epithelial layer has regenerated, and underlying connective tissue with the myofibroblast which has started to contract the wound. This is again just a brief overview. Injury occurs, platelets arrive, they release growth factors, cytokines. At the same time, neutrophils, macrophages will be attracted towards the wound. Then these neutrophils and macrophages, they will also release some growth factors and cytokines which will attract the fibroblast and blood vessel cells towards the wounded area. Then these epithelial and wounded endothelial cells will produce certain growth factors which will cause the synthesis of more blood vessels and extracellular matrix components. Then these fibroblasts will cause remodeling of the scar by producing extracellular matrix and matrix metalloproteinases. These are the growth factors and cytokines which are involved in various steps in wound healing. Students, you need to memorize this table. This is very important. So this is a diagram showing multiple or diversity of the macrophage. Macrophage performs multiple functions like removal of the injured tissue and debris by phagocytosis, collagenase. They can perform the antimicrobial activity by reduce reactive oxygen species, nitric oxide. They are involved in chemotaxis and proliferation of fibroblasts by releasing these growth factors. They are also important for angiogenesis, and they are also involved in deposition and remodeling of extracellular matrix. This diagram is also very important from your examination point of view. Now comes toward the factors which may retard the healing process. Certain systemic factors as well as the local factors, they may retard wound healing process. Systemic factors include the nutrition, metabolic status, circulatory status, and certain hormones. Nutrition, like if in case of deficiency of vitamin A or proteins, it is very likely for healing to be delayed. And in case of the metabolic status, for example, in diabetic patients, their metabolic status is disturbed, so the healing is delayed. In case of the circulatory insufficiency, where blood doesn't reach properly, doesn't reach the wounded area. So as you know, the blood carries the important nutrients and cell towards the wounded area, which are important in healing. So if that circulatory insufficiency occurs, so automatically the healing of wound will be delayed. Certain hormones like glucocorticoids, they are also important. They also, if they are increased in number, they will delay the wound healing. Local factors like the infection, if the wound gets infected, automatically wound healing will be delayed. Mechanical factors like early mobility of the wounds, it also retards the wound healing. Foreign bodies like some entrapment of a glass particle or a wooden particle, they may impede the wound healing. If the wound is located in a highly vascular area like in the face, they will tend to heal more rapidly as compared to the wound located in those areas where they receive less blood supply, like in the feet. These wounds they will take some time to heal. So this is a pictorial overview. Vitamin C and proteins are very important for wound healing. In case of the arteriosclerosis, the blood flow is impeded, so the wound healing will be delayed. In case of the diabetes, wound healing is also delayed, and the glucocorticoids also delay wound healing. Infection will also delay wound healing. Early mobility, and especially if anything is penetrated within the wound, it will also cause the wound healing delay. There are certain complications related with the wound healing. These include wound dehiscence, like there is premature opening of the wound sutures or ulcer. They will also cause the wound to these are involved in wound complications. And in other ways, it is also possible that there is excessive granulation tissue formation, like the hypertrophic scar and keloids. And in some ways, contracture may also form, which will lead to decreased mobility, or it will impede the mobility of that area. So this is the keloid and this is the hypertrophic scar. This is a table which shows the differences between keloid and hypertrophic scar. Please go through this table. So when the chronic inflammation is constantly present, there is a persistent stimulus for chronic inflammation. What happens? It will cause the activation of macrophages and lymphocyte, which will release certain growth factors and cytokines. All these will contribute towards increased collagen synthesis and ultimately fibrosis. So the key points for this lecture were cutaneous wound healing is the process by which the skin repairs itself after any kind of damage. Healing by primary intention occur in wounds in which the dermal edges that are close together. Primary intention typically occur in 4 stages like the hemostasis, inflammation, proliferation, and remodeling. Wound contamination, it increases the risk of surgical site infection, which can influence with the wound healing. So students, that's all for today. Hope you understood it. In case of any queries, please do let me know. Thank you so very much.